For most individuals with erectile dysfunction, first-line therapy is to try lifestyle modifications and sensate therapy. For those individuals where this isn't successful, second-line therapy is pharmacologic interventions. However, some people either can't use the traditional pharmacologic interventions due to certain risk factors that make the medications contraindicated, or would rather avoid medications at first. Here, we will introduce the alternate interventions that are non-surgical in nature for the treatment of ED. First up are vacuum-assisted erection devices. These mechanical devices are generally recommended first before other options since they are non-invasive and less expensive than other options. The way these mechanical devices work is by creating or increasing pressure for blood flow to come into the penis while preventing it from going out. Here's how it works. Your basic pieces are a cylinder for a penis, a pump to create a vacuum, and a ring to keep the pressure in place. You begin by placing the ring at the base of the shaft, then adding the cylinder and the pump. By creating pressure, you will cause the penis to become erect with blood flowing in, and the ring at the bottom will prevent the blood from leaving. While it can be a little cumbersome to use, once you become comfortable with using it, many men create an erection sufficient for sex. Studies have shown that vacuum devices can successfully create erections in as many as 60 to 70% of patients. However, satisfaction surveys have indicated people are not entirely satisfied. One of the drawbacks of the vacuum pump is it may be difficult to ejaculate externally. This is because the occlusive ring that prevents blood from flowing out of the penis will also prevent semen from entering into the penis and ejaculating. However, you will still feel a normal orgasm. A more invasive option for individuals is penile self-injections. In the United States, the only drug approved for injections is called prostaglandin E1, which causes the blood vessels in your penis to dilate. It does this by blocking the part of the sympathetic nervous system that causes constriction of blood vessels to the penis. With more blood flow coming in through the arteries, it actually compresses the veins in the penis, not allowing blood to leave and thus keeping an erection stable for sex. In one study, penile self-injections over a 6-month period had 87% satisfaction rate, which is really great. The downsides of this are penile pain or aching, which are more related to the medication than the needle used for the injection. This can occur in up to 50% of patients. Additionally, there is education and teaching required before being able to self-administer these medications. Finally, a more serious side effect is prolonged erections, which occurs in 6% of patients. This requires immediate urological attention as blood must be unclogged from the penis. Finally, the last non-surgical technique that can be used is administration of the same medication in penile self-insertions, the prostaglandin E1, which causes increased blood flow, but to do it through the urethra or the opening of the penis. This has the benefit of being less invasive, yet can be painful like the injections. The downside is that it doesn't work as well as the injections. In one large trial, only 66% responded to this method versus 87% in the injections. The vacuum constriction device is available without a doctor's appointment, so you should still have a conversation with your healthcare provider before using it. However, the injections and the urethral administration of the vasodilators do require seeing a physician for evaluation.